The rate of growth day over day has stabilized, with the outbreak of this virus having likely peaked in the community. And we are trending toward a best case scenario rather than a worst case scenario.
Physical distancing measures are working, according to the province, but health officials say we're not out of the woods yet. Dozens of people are now being treated at Windsor's Field Hospital. We'll hear from the daughter of a 92-year-old woman in one of those beds. She was one of the first to move into the space. I'm Chris Ensing. Thanks for joining us. Community spread of COVID-19 appears to have peaked earlier than expected, but public health officials say that they don't expect to ease restrictions yet. The big issue continues to be long-term care and retirement homes. It's a story that's playing out across the country, and especially here in Windsor, Essex. 6 more people died this weekend, each a resident of a long-term care or retirement home. 4 were women ranging in ages of 60s to 90s. 2 men also died, one in his 80s, another in his 90s. In total, 27 people have died of COVID-19, and 20 of those deaths are linked to long-term care or retirement homes, according to the health unit. The number of confirmed cases, it continues to rise here. 482 positive tests as of today, with 80 people having recovered from the coronavirus in Windsor, Essex. The number of people waiting on test results, it's also gone up, but so is testing. The health unit did more than 1,500 tests in the last 7 days as the battle shifts to our seniors in long-term care facilities. Now, some of those seniors are about to spend weeks at the St. Clair College Field Hospital. We gave you a tour of the 100-bed facility on Friday. People living at long-term care retirement homes who have COVID were moved there this weekend. Amy Dodge now with a look at what that kind of move is like.
We spoke with Charmaine Edwards. Her mother is 92. She was one of the first people who moved to the Field Hospital from Heron Terrace. We reached her in BC today. She says when they watched the CBC's tour of the Field Hospital on Friday, it was overwhelming, but it really reassured her that this is exactly where her mom needs to be.
You know right away that everybody did their very best to make this place a place for people like my mom who can heal from COVID-19, and that they would be getting the very best medical care, I think, in the world.
Heron Terrace moved 28 of its residents to the Field Hospital. John Scotland is the CEO of the home. He says the main issue for them right now is staffing. He says they usually have 90 care staff, and now they only have 30. Shifting residents to the hospital helped address some of those problems.
So for us, it was what's in the best interest of our residents? Where can we be assured they will get the care they need? And it wasn't hard to make that decision.
What was a challenging decision for Scotland was around patients with dementia and whether they should be moved. This is a question that was also raised by critics on Twitter, including Dr. Samir Sinha with Sinai Health System in Toronto. He was concerned the stark white walls and bright lights in a field hospital might traumatize dementia patients. But 20 minutes after he made his tweet, Windsor Regional Hospital called him to hear his concerns.
What was clarified for me was that we're really going to be highly selective on who we actually send to these settings. We're going to be quite mindful of thinking about dementia. We're going to try and bring people's personal belongings, and we're going to try and do those things to try and minimize the risk of delirium.
Well, these are concerns. People with dementia aren't necessarily being moved. Scotland says if it is better for them to stay where they are, then that is exactly what's being done.
So I also spoke with the hospital, and the 28 patients I'm told are doing very well, that they have access to iPads and can speak with their families. I'm also told that they have mild to moderate symptoms. As for the families who have loved ones at the field hospital, they say they are relieved that they are in a better place for their care. Amy Dodge, CBC News, Lakeshore.
New numbers released by the province show Ontario's gaining some ground in fighting the COVID-19 pandemic, but we're yet to flatten that curve. It remains unclear tonight on when things will get back to some sort of normal, but Lisa Shing has more from Queen's Park.
We face this enemy head on. We did not shy away from difficult decisions. Community spread of COVID-19 appears to have peaked, according to Ontario's premier and top health officials. While earlier models predicted that peak in cases would happen in May, today's numbers show public health measures like physical distancing and shutting down non-essential businesses have worked.
And when I say we, I mean all of us, everybody listening, everybody who has participated in the public health initiatives. You've made a difference.
The rate of growth in COVID-19 hospitalizations has slowed, while the number of patients in intensive care units has remained relatively constant over the past week. The total number of cases for the span of the outbreak is now likely less than 20,000, substantially lower than the 80,000 cases projected in the modeling from 2 weeks ago. But there aren't any predictions of deaths because about half are in long-term care homes where the spread is unpredictable and seems to be growing. Officials say they're also concerned about other settings where people live in close quarters.
When you see a wave of infection going through long-term care homes, it is unfortunately and tragically going to be followed by a wave of mortality as well.
According to the province, there have been outbreaks at 127 homes as of April 19th, where 1,500 residents have tested positive. More than 350 have died, and more than 800 staff also have the virus.
I don't think anyone around the world could have predicted COVID-19 coming out exactly the way it did, with its level of attack on our most vulnerable people.
Despite measures like mandatory masking of workers and wider testing of residents who are symptomatic and their asymptomatic contacts, critics say the situation we're in was in fact predictable.
I think we're paying for what was in long-term care really a flat-footed response to really prevent a lot of what we're seeing now. What's happening today needed to happen 3 weeks ago.
As for opening up the economy, Premier Doug Ford says he's asked his officials to come up with a framework. We know it's going to be gradual and measured. As to when it could happen, well, that all depends on how well we stay home, wash our hands, and stick to those public health measures. Lisa Shing, CBC News, Toronto.
Back in Windsor 5 months ago, a garage fire forced 200 people out of a downtown Windsor high-rise. They haven't been able to move back in, and now some are having troubles getting stuff out. A hearing in the class action lawsuit against Westcourt Place was supposed to take place today, but COVID-19 has delayed that process. CBC's Sanjay Maru joins us now. How are people dealing with all this?
Well, Chris, frustration certainly continuing to be the theme here. It was back in November that about 200 tenants were forced out of their units after an electrical fire, with no end in sight for when they can return. Now, months later, access to their belongings is still an issue. Officials with Westcourt Place say while the building is considered closed, residents can still ask for permission to enter their unit, but they have to do so under strict distancing protocols. One of their tenants, however, says that process isn't so simple. You're looking at a laptop and 2 bags of clothing. These are the only personal belongings Alexis Hand has on her right now. She recently hired a company to enter her apartment in Westcourt Place and assess her belongings for smoke damage. If it had been determined that her belongings were fine, she would go in and retrieve her things, but that never happened. That's because when she informed the building manager that this company would be coming in, she was told that she would need permission from Westcourt's lawyers. It's been a little more than 2 weeks since she reached out, and Hand says she's heard nothing back.
We don't have any contact for their lawyers directly, for the building owner. It's just our building manager who we've already dealt with when we lived in the building, you know, handing in our rental checks and stuff like that. So she'll then relay the messages to the owners, to their lawyers. So it's very frustrating and it's very difficult because, you know, I said, well, why wasn't I told this before by you that I need to get approval from the lawyer? And she's like, well, I didn't know. And I'm like, well, then this isn't working out very well, this line of communication.
Now, that fire from November forced Hand, along with her boyfriend, to move into her mother's place. Hand says without her belongings, she can't even consider looking for a new place to live. She also says her 56-year-old mother has been more than accommodating with having her and her boyfriend stay at her place. But of course, Hand is concerned about things like going grocery shopping, picking up the coronavirus, and passing it on to her mother.
We got a really good sense of the frustration that she's feeling in that clip there. But what about financially here? How is this playing out for residents?
Well, according to another resident, James White, it's twofold. He's the individual behind an online group for more than 100 displaced tenants from Westcourt Place. Now, White was able to find a new place to live after the fire, but he's now paying twice as much in rent. On the other hand, he knows of many other tenants who don't have the means to do the same.
shopping for a new apartment when, you know, your former Westcourt and COVID-19, there are still some people in our group who haven't found a new place and are still couch surfing right now. And they've been looking quite hard, and it's very, very difficult. There isn't really very many showings going on. I'm in a lucky little circumstance. I mean, I did not get an affordable place. I got what I could get that was on the market. And a lot of us had to make the same compromises. Either we, you know, couldn't live downtown or we had to pay a lot more.
Now, in that conversation, White also raised concerns about whether or not repairs to the apartment would be made because of this pandemic. And to that, officials with Westcourt Place say repairs are authorized to continue since work started prior to the outbreak. However, Chris, COVID-19 is expected to add months to the reconstruction schedule.
Just difficulties on top of difficulties. Safe to Sajay. We're turning now to the tragedy in Nova Scotia. The RCMP say that at least 18 people have died in one of the worst mass killings in Canadian history. Investigators are combing through multiple crime scenes looking for answers and possibly more victims. But what continues to elude them is the motive behind the killings. Simon Dingley reports.
A convoy of forensic vehicles arrives on a road in rural Portapique. The bloodshed began at a home here Saturday night. Police found bodies both inside and outside that house. It's one of 16 crime scenes being investigated, and the death toll could rise. There were also 5 structural fires, most of them residences.
We believe there may be victims still within the remains of those homes, which burnt to the ground.
Police say some victims knew the gunman, some didn't. He drove a mock police car for part of his attack and also wore what appeared to be an RCMP uniform.
In terms of the police uniforms, we don't know the origin of the uniforms, but we certainly have reason to believe that they were either actual uniforms or very good facsimiles thereof.
The suspect was killed Sunday morning at a gas station, but not before traveling more than 80 kilometers through multiple locations over a 12-hour period. But residents weren't notified by phone. The emergency alert system was not activated. Instead, the public was informed in a series of tweets.
People were making decisions as they were trying to protect their community, and I'm certainly not going to judge the decisions that were made yesterday in due time.
Among those killed, RCMP officer Heidi Stevenson, a mother of 2. Jesse Kasavicki knew her and brought flowers to her detachment.
She was caring, compassionate, fun-loving.
RCMP Constable Chad Morrison returned home to a hero's welcome. Morrison suffered gunshot wounds during the rampage.
The heart behind us has meaning. It's about our love for each other. It's about strength, and it's about getting through this together.
I want to ask the media to avoid mentioning the name and showing the picture of the person involved. Do not give him the gift of infamy. Let us instead focus all our intention and attention on the lives we lost and the families and friends who grieve.
But as the country mourns, investigators must figure out why this happened. The RCMP says that could take months. Simon Dingley, CBC News, Toronto.
Flags at half-mast in our city today. Hotel de Grace honored those who died in Nova Scotia, including 2 of their healthcare colleagues who worked with the Victorian Order of Nurses, who also lost their lives. The healthcare center expressed condolences and grief on social media earlier today. City of Windsor facilities are also lowering their flags as a sign of respect for the victims and families of those affected. The province has reached a tentative deal with the secondary school teachers.
We're aware of the students' need for some stability in their lives, and under those circumstances, we did our best to reach a deal that would come as close as it could to meeting the needs of my members and the needs of students in the future.
Details of the agreement were not immediately available, but Bishop says, well, teachers didn't get everything they wanted. They recognize these are extraordinarily difficult times. High school teachers were the final major teachers union without a contract. The education minister says the deal advances the priorities of parents and teachers. Two legendary icons in Windsor Detroit broadcasting have died, one of them from COVID-19.
It's time for a Swingin' Time special. The world's most exciting vocal group, the Sensational Supremes.
12:35 at CKLW on the Johnny Williams Show.
Robin Seymour was the host of Swinging Time right here on Channel 9 television back in the 1960s. This program introduced a number of Motown acts to the world, such as the Supremes, Stevie Wonder, Martha Reeves, the Vandellas, many, many, many more. He was also a DJ at Keener 13 in Detroit, the host of another television show called Teen Count. Seymour died in San Antonio, Texas on April 17th of a heart attack. He was 94. Johnny Williams was a Big 8 announcer from 1968 to 1983. He died the same day as Seymour at Beaumont Oakwood Hospital in Dearborn of COVID-19. Williams, whose real name was Tom D'Angelo, is being remembered as a gentle and humble soul with a great sense of humor. How beautiful is that? The sounds of a piano and a violin, friends and neighbors in Chatham, Kent. At a time when things are really difficult and sad, they wanted to make music to ease some of the worries. Sue Lowther, playing the piano, reached out to Jennifer Trinka, asking her to go to her backyard with her violin. They opened up the doors, the windows, and keeping a safe distance, they played and expressed thanks to those who are on the front lines. Have a listen. We'll have your full forecast after the break. The COVID-19 pandemic has forced the cancellation of one of Essex County's biggest tourism draws. The Festival of Birds would normally start up soon, drawing thousands of birders to Point Pelee from around the world, but it's been canceled. Now that the park is closed, there's still another way to spot a bird, though. Experienced birders say that you should work on a yard list, not a yard work list, but the list of species that you can spot in your own backyard. And if the backyard is too far or uncomfortable, or like me, you don't have one, there's websites where birders can view live stream cameras of feathered friends if they don't want to leave the house. Joining us now for a look at the weather is Colette Kennedy. Colette, pretty soon I think I'll be able to look at my head and see a couple birds poking out of the sides here. This thing is pretty much a nest at this point here. It's getting rough. It's getting rough, Colette. You taking the scissors out or no?
Oh, I did actually. I did last week. Yeah.
Not
you
bad.
know what? We're all in this together, right? So if we're all gonna look like, we haven't had professional haircuts, that's how it goes. And I think you look terrific, by the way. So no worries there. No worries with the weather today. And it's not that there are worries, but there are changes coming. I don't know how much you're going to appreciate them in terms of a system that's moving towards us. It's 13 degrees at the moment. A little cooler, obviously, due to the lake effect there into Chatham-Kent. You can see those winds coming off the lake, so only 8 degrees for you there at the moment. But the winds I really want to draw your attention to, obviously, when we see winds coming in off the lake through these areas and through Leamington, we get into some issues with the flooding, and so that will be a concern as the winds will be ramping up through the day. On Tuesday, we're going to find some of those winds gusting 50, 60, and as you saw, possibly at times over 70 kilometers an hour. So a blustery day ahead on Tuesday. Now the precipitation to go with it, obviously not bad today, this evening quiet as well, but as we get into the later evening hours, this is the system that's going to be moving in. So this is essentially the cold front, where ahead of it we have the showers, and then this is kind of delineating the leading edge of a new air mass that's going to exchange and move in. As it does, we see the temperatures falling off a little bit. We may get a little bit of mixed precipitation. As it cuts through, a thunderstorm, not out of the question, would be isolated. And back behind the front, we have a west to northwesterly flow. I showed you that when we were looking at the wind maps, but the importance is how strong those are going to be. And also, there will be some lake effect off towards the east and northeast. We'll probably catch some of the cloud cover and maybe some scattered flurries, not contending as much with the lake effect, but that potential is there. So the temperatures tonight, they lay out like this. So 2 degrees for Sarnia, 3 here into Windsor, Leamington, 3 degrees in Chatham-Kent as well, a little cooler towards London. The scattered flurries tomorrow, a huge departure from today in terms of the temperatures that we'll be seeing with those strong winds, making it feel even cooler. But Wednesday we'll start to pick it up, and we will gradually take baby steps till we can get back to double digits as we go towards the end of the week and the weekend, Chris.
Always important to watch those winds. Thanks, Colette.
You're welcome.
Coming up, the pandemic can be a difficult time to find a job and a difficult time to hire the right person, but there's a new registry in Windsor that could help people out. For those who are at home and looking for work, there's a new registry to help link up employers with potential workers. This after a survey showed that there's a need for labor with more than 400 jobs available right now, half of them considered essential. About 100 have already been filled. This is a joint venture between the city and Workforce Windsor Essex. They're also offering incentives for potential workers.
You need specific tools in that industry. Some apprenticeship programs require you to have tools before you start. And so those are the type of incentives that we're talking about, that we can assist those potential candidates to get those jobs. And I think it's really, really important because we, again, as I mentioned, do not want that to be a barrier for employees to find employment.
He says the majority are regular full-time positions, but there's some temporary and part-time jobs as well. Those interested in registering need to contact the city's Employment and Training Services Office. Information is available on our website, cbc.ca/Windsor. We heard from many of you during our We're in This Together campaign, examples of good deeds in our community. Here's a video that stood out from a healthcare worker right here in Windsor.
Hi there, my name is Kelly. I work in the renal dialysis unit at Windsor Regional Hospital. I wanted to personally thank the residents of Windsor and Essex County for your ongoing support and generous donations towards the hospital. I also wanted to personally thank Sue Fader for the homemade scrub caps. You did a great job. Please stay safe, wash your hands, and stay home.
Hear from more of you about what your mantras are. Maybe they're similar to that. Stay safe, stay at home. I keep signing off all my emails hoping people are healthy. If you share yours with us, it could be something we play on any of our platforms, radio, TV, online. Just give us a call on the talkback line, 519-255-3400. Or you can send a video or a voice note to community@cbc.ca. It's 6:29 p.m. and that's it for CBC Windsor News. But first, we want to show you a look at what's happening at the WFCU Centre. This is where they've created sort of like a food bank system. People packing up cardboard boxes, preparing it to be delivered to those who might need a little help during a time that's been difficult for everybody, this COVID-19 pandemic. A reminder, all of our stories are on our website, cbc.ca/Windsor. You can find us on Twitter and Facebook as well. Just search CBC Windsor. Thanks for watching. Have a good night.